we performed a randomized prospective study was designed to determine the role of silicone oil in the surgical management of endophthalmitis. We presented this study approximately 20 years ago, and as far as my knowledge, this was the first report using silicone oil to fight against endophthalmitis. I did this study with my teacher, Dr. Payman, and we presented this at the ARVO meeting in 1997. And 2 years later, our group at Istanbul University also showed that silicone oil has in vitro antimicrobial activity against endophthalmitis-causing agents. Silicone oil may have advantages of not having any metabolites for the growth of microorganisms, not allowing the microorganism to grow by occupying the vitreous cavity and preventing the collapse of globe. Physical properties of silicone oil, like having high surface tension, tendency to form a single large globule, and resisting to the entrance of cellular debris proteins are the reasons for this advantage. We included 42 patients whom clinical signs of endophthalmitis developed within 6 weeks of cataract surgery, phaco, or secondary lens implantation. All patients had advanced and severe endophthalmitis. They were randomly assigned to treatment with vitrectomy with or without silicone oil. The visual acuity was light perception. The follow-up time was approximately 1 year. 22 patients received silicone oil, 1,000 centistokes, and 20 patients had balanced salt solution. Both groups received infusion fluid containing antibiotics and corticosteroids during the vitrectomy, and postoperatively, they received topical antibiotics, cycloplegics, corticosteroids, and systemic antibiotics, corticosteroids. When we look at the results, media cleared much more quickly in the silicone oil group. All eyes in the silicone group had clear media, while only 70% of the BSS group had completely clear media. During the follow-up period, there was no retinal detachment in the silicone oil group, but the incidence in the BSS group, retinal detachment rate was 20%. None of the silicone oil group required additional surgery, 20% except removing the silicone oil. 20% of the BSS group had additional surgery. The visual acuity was better in the silicone group than the BSS group. Fundus details could be evaluated more clearly in the silicone oil group in the early postoperative period. We think this is an obvious advantage from the point of awareness of early postoperative retinal complications. In conclusion, we found that the results of this study indicate that silicone oil can be considered in the surgical management of advanced and severe cases of endophthalmitis. The more rapid clearing of the media with silicone oil could be of clinical importance of certain patients. Thank you.
Looking at your results that you present in just severe endophthalmitis, this change your management also, or less severe endophthalmitis? So do you think we have to use silicone oil in each case of endophthalmitis?
Not in each case, of
just
course not in each case. In severe cases, I try to use silicone oil, but I found it very useful.
No, maybe because I'm young, but I feel more comfortable filling the eye with silicone oil in endophthalmitis.
Yes, and the next day you can see what's going on in the retina. You have a very clear media, and the patients are very happy the next day.
Do you make a more thorough approach to vitrectomy when you consider silicone oil for those eyes, or is it irrespective of how complete vitrectomy is? Maybe Şengül also can comment about that.
I always try to do as much as vitrectomy I can. Even if there's pus on the macula, I don't use a passive suction because you don't have the control of the suction. I use active suction to remove the pus even on the macula. Of course, I not try to make any retinal breaks. I don't aggressively pull the posterior vitreous.
Thank you very much. My question, do you notice anti-inflammatory effect of the silicone oil? Because in the cases that I did, I noticed the eye more quiet and especially the retina. So
I totally agree. The eye was much more quieter with silicone oil.
So is there like anti-inflammatory beside the antibacterial effect of the silicone oil?
I'm not sure about the anti-inflammatory effect, but we presented this in the retina in 1999 that there is some antimicrobial effects on some endophthalmitis causing agents.
Thank you.
Schengel?
Thank you, Dr. Oncel. I agree with you in using silicone oil in endophthalmitis cases, but I select cases. If I see a retinitis and vasculitis severely and diffusely in the retina, I do use silicone oil, even if I don't have any retinal break or retinal detachment. But if there's no retinal involvement, I don't use it. I usually leave the eye in the air. So I think it makes sense to use it in such severe cases. And even in those cases, I usually leave the posterior hyaloid there, because if I try to remove the posterior hyaloid in severely affected retina, you usually end up with retinal break. So you can fix the posterior hyaloid contraction during silicone oil removal, and you can peel those membranes after the eye is better. But if you do it during the inflammation period, you can end up with an incurable retinal breaks. Thank you.
I agree, but I never leave the eye with air or gas in endophthalmitis cases. Thank you.
Can I ask you just a last question to Dr. Sengul? I'm afraid to leave the eye in air because of, as we said, it increases the concentration of the antibiotics, and maybe it makes if the pathogens is an aerobic pathogen, it can grow up more aggressively.